Okay, fine. We can start up then.
All
She's
right.
held up with some work. I will
Okay.
just introduce Dr. Anjali Agarwal to all. She's a consultant physiotherapist, lifestyle consultant and heart manual facilitator, and she is women's health specialist. So I welcome Dr. Anjali Agarwal for the certificate in exercise training on cardiorespiratory fitness course. She will be taking this class. It will be stretched for 3 weeks. So today is an introductory class. Next week on, we will be having the full-fledged class. So before Dr. Anjali starts with the introduction, uh, uh, before Dr. Anjali starts with her class information, I think Dr. Anjali also would like to know who are the participants and what are their names.
Yeah.
So kindly, please unmute yourself and just speak out about yourself and what do you do.
Sure. Hi, my name is Samira. I am a level one. I've completed my level one fitness certification from Karnataka Fitness Academy, and I'm appearing for ACE exam sometime during the end of the year. I work with IBM also. That's my full-time job, and other than that, I'm into fitness.
Good. Welcome, Srinivas.
Thank you.
Hello everyone,
Hi.
this is Smriti here. I am preparing for my ACE exam currently in regards to fitness. Apart from that, I am a graphic designer working at Sense4th AI uh, as a UI designer.
Very good. Awesome, Spurti.
Thank you.
Hi, good evening, ma'am. I'm Kamlesh from Chennai. I am a freelance personal trainer as well as a bodybuilding coach.
Kamlesh is not well, but still he came today.
Yeah,
Right.
You can keep
yeah, not
your
feeling well.
yeah, no issues. Okay,
We'll
Dr.
go
Anjali,
ahead.
then you can just
Yes.
start up.
Yeah. So, just wanted to ask and gather some info about what do you know about the cardiac and the respiratory fitness which is required for anybody who's actually working out to be an athlete or somebody who's actually learning to swim or going on to a track and field or a football ground. What are the goals which you want to see for a particular person who is involved in a particular sports? So we'll be going into details and touching the basis about cardio fitness, which is very important for any athletes or any person who's involved in sports. So as we know that our cardiac health and our respiratory functions, they go hand in hand because the heart is something, an organ which is pumping your blood to every part of your body, to every part of your organs, and the lungs is the a organ which is taking in the bad blood and letting the good blood get out of your body, oxygenate, and that is all going to your muscles, and that's how productive an athlete is or a normal person like us are. So, our goals of this chapter, or what we'll be talking around this, will be how would we look after cardiac health? What will be measured in cardiac health? What would we look at respiratory function? What are the key points which we'll be covering in this entire chapter with relating to cardio fitness also? Now, the key thing about movement and exercise is that what is the function of our cardiorespiratory system in facilitating movement? Right, this is an important chapter. I think all your friends should also take part in it, and you should try to bring them in and learn about it. Everybody who's into fitness, everybody who's looking after somebody, training somebody online or in the gyms or in the sports club or in the fitness arena needs to understand that how the cardiorespiratory system will facilitate movement. Now, if my cardiac health is not good and if my lung functions are not good, I cannot walk from my room to about 10 steps also. So, for an athlete, suppose he's broken down and he had a crash on the ground, for him to recover out of that injury and to able to go and hit a goal in the football ground would need a cardiorespiratory health fitness which gets affected during the injury management also. So, how well you can cater to that health group for them, we'll be talking a lot on those chapters also. It's like easy, but it's kind of little tricky because each athlete is very specific. And for a swimmer, for a golfer, for a tennis player, for somebody who wants to run a relay race, or somebody who wants to do go karting, and a horse rider or a polo rider, the cardiac efficiency would differ with respects to the sports they're taking care of, or with respects to the movement. So the movement will decide the kind of exercise that sports person would need, and how the athlete can conveniently work on his cardiorespiratory health. So as we were talking about, the key points were that we are already dealing with exercise, sports, cardiac health. We need to understand that I want to maybe do mountain climbing, or my goal is to be climbing Mount Everest maybe in the next couple of years. What kind of training do I need in an environment which is oxygen deficient, which is actually, I know that this person doesn't have a good cardiac efficiency, right? Mr. A, Mr. B, Mr. C. Mr. A has never walked 100 miles, also never. Mr. B has done marathons, and Mr. C has done swimming, but has not done walking marathons, has not done anything beyond that. So now we have to categorize how we would look at their cardiac health with respects to the sports they played and with respects to the goal they want to achieve. So the goal of achievement which we want for them is to climb a Mount Everest, right? I have a lot of mountaineers as my clients and my patients, as my friends who have like climbed Mount Everest, not just once. They have attained maximum of the peaks in the world, and they're all young girls and young people. How they've achieved it and how they've gone ahead with somebody who had cancer. So there, I know about a client whose dad is a doctor, was a cancer survivor, and has taken the daughter to climb Mount Everest. So imagine somebody who's got, chemotherapy, the lung function decreases, but yet has been able to go to the Mount Everest. So we look at how specificity of particular conditions, how cardiac health and sports can be related together. We're also looking at exercise capacity and different tests. Like if you want to look at somebody who wants to swim versus somebody who wants to climb Mount Everest, the tests required for measuring their cardiac efficiency, their respiratory efficiency would differ. And that way we'll tailor make our program as per the person specific sports needs of a person. Another topic which we will be talking about is the risk and innovation to advanced training. Okay, Kamlesh and Spurti and Srinivas, how many of you have heard about somebody who ran a marathon, had a sudden collapse, and we lost them? You can unmute yourself and talk. You have heard. What could be the
Yeah,
reason?
quite,
What did you
quite
hear?
often.
What did you hear? Why
They
he?
had a mild heart attack or they collapsed because of not a good cardiac respiratory fitness.
Yeah, so
Cardiac arrest, maybe.
yes, cardiac arrest. It's called as a sudden cardiac death. Like it's like all of a sudden. And what are the key reasons it happens? What is lacking in our cardiac health training? We'll talk about that also, because all of us, including all of you, would come across some scenarios a lot. So when I go to do my workouts in the gym, also I would be running on my treadmill sometimes, and next to me will be a guy who would run, maybe just have finished office and just straight away without any warm up, without any hydration, just goes onto the treadmill and starts running, and goes to a very high speed limit and just falls and collapses right in front of me. So at that time, sometimes we have to really rescue them, along with people who were, looking after or supervising the gym also. But what are the things which we can look at? How we can prevent the certain cardiac deaths? What our roles are and goals are around it? We'll be talking around that also. Now, the main thing, principles of cardiorespiratory fitness. What are the key roles which you think Spurti can be in, which we will see in a person? If suppose I want to take somebody who wants to do a mountain climbing, what are the basic things which you look at for them for cardiorespiratory fitness?
Their oxygen levels need to be on the higher sensitivity, ma'am, because when you go at the peak, Your lungs should have that capacity to take in the more of oxygen and pump out more oxygenated blood throughout your system.
Very good. And there's something about, have you heard about anaerobic breathing capacities and all?
Yeah, anaerobic breathing. Yes, I have heard about it.
Very good. How about Kamlesh? If suppose somebody wants to do diving, like, underwater sports, what are the key things which will we look for cardiorespiratory fitness for them?
Uh, he has to hold his breath, right? Has to hold good lung capacity, holding the breath for a
Right.
diving person. It is a must.
Good, good. So I think all
Good
of you
aerobic
are very
capacity.
good, Srinivasa. Yeah. So we see that a lot of like people tend to not give a lot of importance to the muscle mass energy. Like we talk about oxygen capacity, we talk about anaerobic respiration and everything, but a lot of thing goes away where we don't talk about how to relax their mind while they go into the water. Yeah, that is very important, right? When they get panicked, their oxygen demand would increase. So how, as influencers and all, we can play a role there? Okay, that's one chapter we'll take. Sorry. So we have another topic which we'll be talking about principle of cardio training. So there are a lot of rules which we need to follow when we do a cardio training. And I, being an heart manual facilitator, we look at a lot of people having cardiomyopathy, which is the cardiac muscles get really enlarged. Okay. And the efficiency to pump in blood or pump out blood or oxygenate the blood decreases with high impactful sports, or if they played sports, if they ran marathon from long term. So we really need to work on this cardio training. Specificity of cardio training is very important, and the principles of cardio endurance. So I'll go to the major topic here. So there's a risk of, like as I says, deceased person because of cardiac arrest is somebody where we are not able to evaluate how fit the person is, how unfit the person is. So before we embark on any kind of cardio training, we have to have specified testing or physiology testing for an individual to understand at what level that person is. Like, what is his score of efficiency to work on his cardiac health? What kind of exercise he can take? What should be done to increase his cardiac efficiency? So, that are the specific tests and values we'll be looking at also in our chapters in the covered weeks also. Now, as we said, the body composition and the decision to do an exercise prescription. So, Srinivasa, tell me, what do you mean by body composition? Hello? You're there, Srinivas? Or Spurti or
Yeah,
Kamlesh?
I'm here. Sorry, I was on mute. Yeah.
Right, right. So, what do you mean by body composition, and what do you think can be given to somebody who's very obese but wants to do a mountain
Body
climbing? Suppose.
composition. Okay, body composition about the percentage of fat muscle mass and lean muscle mass that they have.
Hmm.
That's
Right.
their body composition. So based on their fat muscle mass, we'll have to, like you mentioned, we'll have to tailor fit the workout program or design.
Right. And suppose somebody who's on a higher value of BMI and wants to do a recreational sports, wants to do a mountain climbing. What kind of prescription of exercise would you give to him?
Yeah, yeah. Initially, probably, I mean, if the BMI is too high and if the person is obese, probably we may not be able to give any weight bearing exercise because we may end up injuring their
Correct. Right.
lower extremities of the body.
Very
So
good.
we'll have to keep that in mind and then reduce their weight and then help them perform better in their physical activity, and then eventually they will be able to do that climbing activity.
Good job. Spurti, you want to add on something?
Along with that, nutrition also needs to be taken care. Whatever program we have to be, we are giving them. So nutrition also will play a very important role for the obese people, is what I have actually experienced it, because I have been handling two of the clients for weight loss. So initially, what was happening is there was no much of weight reduction happening. But
Hmm.
then later, when we tweak their metabolism with the proper nutrition, exercising was much more effective in terms of weight loss.
Correct. Obviously, it's like diet, nutrition, and exercise. They always go hand in hand. I'm like one is interdependent on the other. Surely. Kamlesh, you want to add on some points here?
No, ma'am. No, no.
No? All right.
I
All
believe
right.
that will do.
Right. Okay. So, as I said, the risk of advanced training is the cardiac arrest. These are very tragic deaths. They've been like super fit people. And we had a lot of tennis players who had a cardiac arrest on the field, right? So we really need to understand what is that sudden cause, how we can prevent it as best as possible. Not working out a lot, but interim working out is what we have to target for these people. Now, the basic principles which we'll be working about would be physical activity, leisure exercise, and competitive sports participation. So that's how we'll be dividing our talk and our whole study program on. And basic exercise intervention and the characteristic of exercises which can be given. And then we classify the exercise as per the sports, like what you're playing and all. We'll also target, as we talked about, this example of obesity, hypertension, and hyperlipidemia and diabetes mellitus, which is diabetes as such, sports and exercise with aged population. So we might just not see the young lots coming to us for any kind of recreational demands in sports, but they will be people who are aged, like over 40, 45. What's happening to their heart and what is their goal or principles involved? So we'll have to do risk stratification. What is that? What are their chances of getting a heart attack during an exercise program? What are the exclusion criteria, like which people we can take? Like you see that you go to a recreational sports area. Suppose you want to go and you want to fly, right? You fly a parachute or you want to do a bungee jump, right? That's again a recreational sports. What is our goal here is to understand who should not be included. We know that higher heights are not good for people with neck issues and all. But at the same time, there's a lot of cardiac demand increasing for somebody who's falling free fall from a height. So look at that aspects. We'll be talking on that. And the indication and modalities which can be used to emphasize exercise for these people. And what are the things which we do in clinical settings as cardiorespiratory physiotherapists? What we as physios do to increase their lung capacity or to increase their heart lung function? We'll be talking on that. And what you can also emphasize and implement on their lifestyle too. Now, we need to identify the cardiovascular disease and also stratify the risk of the individual who are taking part in recreational and competitive sports. So we have to look at who are recreational and who are competitive sports. Now, Spurti, tell me what will be different between athletes taking part into recreational sports and competitive sports. Spurti, are you there?
Currently, I have I have very vague idea. So I'm not really sure like to answer it. I'm not.
Yeah, that's fine. Just add on your points. We'll work around a lot of your fitness or weight loss clients. Do you think they take part in recreation sports or they're into competitive sports too?
They are more into recreational, I believe,
Yeah. So we'll
not
be looking
competitive.
at all those chapters and we'll also look at exercise related adverse cardiovascular events. So as I talked about marathon running and the heart getting enlarged, that is one chapter which I really talk about. Then there is certain cardiac death in athletes, and then a lot of certain cardiac death and exercise. What is the reason behind it? We'll talk about it. And then we do some screening of modalities of cardiovascular people with young athletes, how we can screen them to be fitter, fittest. Then we also screen for cardiovascular disease for older athletes, which is above 35 to 40, how their lung functions are, how they're operating, and how they are behaving with it. Now, the specificity of cardio training would depend on a kind of sports, whether it's running, whether it's swimming, sports activities like badminton, kho, table tennis, kabaddi. And we all know that all contributes for physical activity is to promote a productive life and a healthy life. And that our body parts should work in conjunction with each other. So a lot of like ligaments, connective tissue, body movement, coordination of blood and oxygen flow just not happens with the heart. There's a lot of coordination of our nerve, of our brain, and everything involves a good coordination for a good heart and a lung function and to have a good sports performance. So let's look at those chapters where we will specify how our cardiac training, which involves a lot of balance training. Somebody who has to run a marathon has to involve a lot of biomechanics. So all that and how our heart and lung function would work, we'll talk on that also. Now, we see that there is a swimmer here and we see a principle of cardio endurance. What kind of endurance a swimmer would need and what kind of endurance somebody who's playing table tennis will need. So you all can add me the points. Who needs more activity increase or who needs to balance out the endurance level? Samira, you can talk like on this, like whether a
Yeah, sorry, I
swimmer,
missed the question. What was the question? Specificity of?
whether a swimmer would need more endurance training versus a table tennis player.
I would say a swimmer would need more endurance training.
Yeah. What is the reason? What could be the reason?
Because that swimming is more of a rigorous training than table tennis, because table tennis is where you just need your hand movement and a bit of leg movement, that's all. But swimming is a whole body workout. You'll have to kick your legs as well as move your arms as well, so that would need a more endurance training than table tennis.
Good. Awesome. So, as we said, swimming is in water would require a lot of use of lung muscles. Basically, you are basically using your breathing muscles a lot, and you're trying to stay afloat in a very unsteady surface. So, the demand of the body of the muscles and the oxygen capacity used in a swimming is maximum as compared to diving, swimming, and mountain climbing. These are the three sports which require a lot of cardiac efficiency and lung efficiency. So our principle of cardio endurance would be more on the swimmers, in fact, and that's what is very important. And that's what I wanted to talk about in a brief of intro today, and as to what we will cover. And you all should try to bring in as many of your friends to join the session also, because something such a very delicate topic as per cardiorespiratory health of an individual is concerned, when we are training people either for weight loss or you're training them in yoga sessions or you're training them to be fit to run a marathon or fit to be doing a swimming championship or fit to climb a Mount Everest, all of that we have tailored made, and this program is very suitable and very easy to learn, and tailor made with very easy like very easy examples which we'll be giving you, with very live examples of how our sports people are being trained also. So Samira and Srinivasa, we look forward to seeing you, Spurti and Kamlesh too.
Sure, we look
Sure,
forward
ma'am.
to
Sure, ma'am.
the future classes as well. Thank you.
Yeah. So we'll be starting
Sure,
our sessions from the coming weekend. And any questions you all have, please ask me now.
What time would the sessions be going forward on the weekend?
What times are good for you guys? Do you want it in the late evening session?
It'll be better
I would
if
the
it is
evening
post
is
6
fine.
o'clock.
What time?
Post 6 o'clock is fine.
Right. Just mention it in that WhatsApp group also. And then we can do that. We can do it maybe post, like just around before your dinner time or something.
Sure. Okay.
Yeah. Kamlesh, you're also
Okay,
fine with
okay.
that?
Sure. Yeah, I'm fine with 6 o'clock. Fine, ma'am.
Yeah. Samira, you too.
I'm fine, ma'am.
Yes, doctor, it's fine. But will it be a 1 hour session, right, going forward? Or
Mostly
2
we're
hours?
doing 2 hour session because there's a lot to cover in the topic, right?
Okay.
Yeah.
Okay. Can we expect a break in between for 2 hours?
We
Because
surely
otherwise
would
it's going
give
to be
you a break in between. Like I would start the session and maybe give you a 15 minutes break. Not 15, maybe 5 minutes break.
cool. Okay.
Okay.
And will
Fine.
it be on Saturdays, doctor? Will it be
That's
on
what we are
Saturdays or
planning.
Sunday?
Weekend only we are planning. Depends on Gopa ma'am and everyone. We could do Saturday and we can do Sunday also, whichever is suitable.
Okay.
Or
Saturdays
we
would
can
be fine,
divide,
ma'am.
we can do 1 hour Saturday, 1 hour Sunday. That way we can do.
Yeah.
Or we can do 2 hours
No worries.
continuously, which is good for you guys.
Yeah, anything is fine.
Okay, let's put it in the
Anything
group
is
and let's
fine.
brainstorm a time for you guys.
Yeah, I would
Okay.
prefer 1 hour a day, 1 hour on Saturday, 1 hour
All
on
right.
Sunday.
I think the learning will be good
Practice it.
then.
Yes,
Yeah.
because
Yeah, you would get totally exhausted with a lot going in one day, right?
yes, and
Right.
also let's say if anybody has any questions, any doubts, so that would go beyond 2 hours.
Yeah. So I would say I'll be giving you a lot of homeworks too, like so that because you carry forward that homework to next day. So like a lot of
Okay.
research you will do on yourself. Suppose you have a client of yours, you can use as an example and I'll do some case studies with you guys. Okay.
Sure.
Perfect.
Yeah. Chalo then we'll take a break now and we'll see you on Saturday coming week.
Cool. Thank you.
Yeah.
Yeah.
Thank you.
Have a good week, everybody.
Thank
Good
Bye-bye.
week.
Bye.
Thank you. Thank you.
Thank you. Bye.